Assalamualaikum and good afternoon, good evening, good morning, depending on where you are. On behalf of the Asia Dengue Voice in Action Group, or ADVA, welcome to this forum commemorating the ASEAN Dengue Day 2021 and advocacy for World Dengue Day. As you all know, this will be a 3-day forum made up of 3 interesting symposia per day, and it will all be conducted in the afternoon of Malaysia, Singapore, and Philippine time. So I'm sorry I cannot give you the times of the other countries in the world. My name is Dr. Zulkifli Ismail. I'm a pediatrician from Malaysia, and I'm representing the ADVA group here. This is despite most of us being very busy with COVID and also the rollout of our vaccines, we have managed to have 3 webinars preceding this forum, starting with one on Wolbachia infected mosquitoes in the beginning, and then by managing the severely ill dengue patient, and then followed by the impact of COVID on dengue. And all 3 had been very successful. And hence the culmination of this forum now. I'd like to take this opportunity to thank the organizations and people who have made this forum happen. And their logos are on the back here, on my right and on my left. And our co-conveners with ADVA are the Global Dengue and Aedes Transmitted Disease Consortium, or GDAC, which is represented by Dwayne Gubler. And then we have the CMEO TropMed network, represented by Prof. Pratap from Bangkok, and the Foundation Miru with Valentina Picot. And we, of course, have the International Society for Neglected Tropical Diseases, represented by my friend Kamran, Rafiq. We also would like to thank the supporting organizations that have provided speakers and also arranged the various symposia, and these include the Indonesian Pediatric Society. Prof. Aman Pulungan is here, and then there's Dengue Expert Advisory Group of the Punjab, Pakistan, with Dr. Somia, and we have the Malaria Consortium, the Tropical Medicine Cluster of Chulalongkorn University with Prof. Usa Tisekon, and the World Mosquito Program. And then we also have the Pediatric Infectious Disease Society of the Philippines, or PITSP, which is represented by, of course, none other than Prof. Lulu Bravo and Rose Capeding. And then we have the Global Vector Hub, as well as 2 companies, Novartis and Bayer, that have also provided speakers to our forum today. And we, it would not do justice if we don't thank the sponsors, the industry sponsors who have made it possible for us to actually conduct this. And these are the 2 which are Takeda as well as Sanofi Pasteur. And then there's the people behind the scenes whom you will probably never get to see. And these are people like Francis Kwong, who's part of the Secretariat of ADVA, Wilson Teo, Joseph Leong, there's Matthew, and there's Arumi, and also Vincent. These are the people working behind the scenes, making it possible for us today. So we really hope that you enjoy the program that's been planned. And also we hope that you will interact as much as possible with the speakers through the question and answer sessions. Now, allow me to invite Kamran Rafiq, President of the ISNTD, or the International Society for Neglected Tropical Diseases, to welcome you all. All yours, Kamran. Please unmute yourself, Kamran, you're muted. I'm not sure whether anybody else can listen.
I think that's better. Sorry about that. I don't know what happened there, but I was just saying thank you very, very much, Zul, for a wonderful introduction. Really great to see you, even if it's virtually and not in person. We are absolutely delighted and honored to be part of this 3-day event. And as Zul said, we're looking at the ASEAN Dengue Day, commemorating that, celebrating the amazing effort that the member states have been putting on in terms of their kind of advocacy around combating dengue, and then also this move towards the World Dengue Day itself. We are in a situation now, as I'm sure all of you are fully aware, where we've gone from the 1970s, a handful of countries presenting with dengue, to well over 100, from 9 countries in the 70s to well over 100, 120 plus countries presenting with dengue. The vectors for dengue, the albopictus, Aedes vectors, Aedes aegypti and Aedes albopictus, are certainly on the march, and we've seen autochthonous cases not just in the tropical regions, but over the last year and a half, mainland Europe, Italy, France, Spain, Madeira, previously the island of Portugal, the coast of Portugal. They've all had autochthonous cases. We ourselves have reported on cases as far up in altitude as Nepal, as an example. Dengue is not going away. It was part of the top 10 global UN health risks in the beginning of 2019. COVID seems to have, and rightfully, taken up the full bandwidth of the global health community. However, what it really has shown is that what COVID has really shown is that partnership is absolutely essential, collaboration is absolutely essential. So in combating infectious disease outbreaks, and especially when you look at dengue and you reflect on the integrated position that the WHO themselves are putting forward, we need everybody on board. And that's very reflective in the country spread that we've seen in terms of the registrations for these 3 days. And also the varied symposia and panels, as Zul's explained. We ourselves at the International Society of Entities will have 4 panels across the next 3 days. And we will be getting into several issues ranging from the kind of new horizons on therapeutics, all the way to vector control, all the way to the central role of the community within all of this. And so I think without further ado, I think it's wise if I pass back over to Zul, who will be introducing the next. What I would end on is saying this, that you have a chat function there. It would be great to have your hellos. We've had loads of them come through already. If you could add your name, your country, and your affiliation, it will help us to then have a reference point and give some shout outs back. We've had people joining us from Indonesia, Professor Adi Uttarani, Professor Soso A from the University of AMU in Malaysia. We've had Dr. Sebastian Horstmann joining from Bayer in Germany, from the Norwegian University of Life Sciences at Konkan in Thailand. We've got a wide array of people joining, so please do feel free to we strongly urge you put a hello out there so we see who you are. I think that's enough for me, so over to you, Zul.
Thanks, Kamran, and thanks for that. It's nice to see you, even though it's virtual. It's I just want to give a slight background into the ASEAN Dengue Day. The ASEAN ministers' decision to have ASEAN Dengue Day was actually made in 2010. And we celebrated the first ASEAN Dengue Day on the 15th of June of 2011, and where all the countries in Asia were celebrating it. And it was officially launched in Jakarta in 15th of June of 2012. So the 15th of June is ASEAN Dengue Day, and hopefully we also get World Dengue Day on the 15th of June. So I'd like to now introduce the moderator for the first session of this forum, and that is Dr. Rose Capeding. She is from the Philippines. She's a pediatrician. Her specialty is in infectious diseases, and she's also Asian Hospital and Medical Center, and also the head of the Medical Research Unit of Tropical Disease Foundation in Makati City in the Philippines. So over to you, Rose.
Good afternoon, everyone. I'm Dr. Rose Capeding from the Philippines, and we are going to start this session. this is about dengue situation in Indonesia, supporting institution, and this is hosted by the Indonesia Pediatric Society. So we'll start with our fourth speaker. I am honored to call on Dr. Aman Pulungan. He is the Executive Director of the International Pediatric Association, and he is also the President of the Asia Pacific Pediatric Association and the Indonesia Pediatric Society. He will give the opening speech on the Indonesia Pediatric Society commitment in combating dengue. Let's welcome Dr. Aman Pulungan.
Okay, good afternoon, everybody. Assalamualaikum warahmatullahi wabarakatuh. Thank you, Dr. Rosario. Yeah, it's an honor for me that let me share the slide. How is my slide?
Yes, we can see you well. Thank you.
Okay. So let me see. Okay. Yeah, actually, I'm a pediatric endocrinology, and genetic. And when Dr. Anggi asking me to give a speech about dengue, well, I try my best because I learned dengue, I think, from Professor Sri Rejuki during my residence. I think it's about more than 25 years ago. And my first cases during our national conference, dengue in the whole family. And after that, of course, besides taking care of the organization, in my daily practice, I'm consultant for the pediatric endocrinology. So I like also today to share what's the situation in our country, and also besides part of Indonesian Pediatric Society, I'm also the executive director of the IPA. I would like also to share some data. What's the dengue situation in other countries? Okay, let me go to the next slide. We know from WHO that the 10 global health rates globally, about 50 to 100 million symptomatic cases each year, most common cause of acute febrile illness requiring hospitalization in Indonesia. So, speaking of this, if we see any children, any person before in Indonesia, especially in Jakarta, the first thing we should have in our mind is dengue. Before COVID pandemic, of course. And right now, there are a lot of other things besides that, including COVID. You can see here how the burden and the mortality, the deaths about 1 to 5% in severe case. And in Indonesia, the mortality for COVID in children about 3 to 5%. For the severe case in our hospital, about 10 to 15% the mortality for COVID-19. So for right now, COVID-19 mortality is a little bit higher compared to dengue. How about the Indonesia? The very high burden of dengue. You can see here age standardization global incident mortality rate from 2019. Indonesia is number 3rd highest standardized incident rate population after Barbados and Dominican Republic. Of course, you can discuss about this because I saw also there is a representative from our Minister of Health, and a lot of our experts about dengue will be here. You can discuss about this, of course, about the data. And the problem is related to this. The incidence rate dengue over years is still increasing every single year in Indonesia, in most the whole country. Even in the beginning of COVID-19 pandemic, we have the increasing of dengue. That's why people try to see if there is a collaboration of this is the two separate infection, because at the beginning of the pandemic, our dengue cases also increasing. The problem is this is related to the high economic burden. So the high cost per head, high incident, high economic burden. You can see here the burden for dengue. We are one of the highest right now in the world for the high economic burden for dengue. So I was telling you before, related to the World Dengue Day, we try to get small survey with the monkey survey for the whole country from the IPA member country on APPA member country. Not all countries submitted, but we have 23 countries submitted. So the result quite interesting actually. We are asking where the dengue actually problem. There are 14 countries said the problem. They have a dengue problem in the country. But in USA, in Turkey, Spain, Norway, Mongolia, Kosovo, Bulgaria, South Africa, they don't see dengue is their problem. How about for dengue in children? Same thing, because most cases, even in Indonesia, is for children in 14 countries, and others they don't see. So about more than 70% said dengue in children, the problem. If yes, the dengue cases increasing during the pandemic. So in India, in Peru, Indonesia, Singapore, and Sri Lanka, they said during this pandemic, the cases of dengue also increasing. So you can discuss it here because you are the expert here. How come this is infection? This is related to the natural, or is it related to the infection itself? So you have to discuss about this, I think. And in 14 other countries, this is not increasing, but doesn't mean this is increasing. Maybe they don't know. They don't have the data. So are there any national dengue cases data? In 15 countries, they have the national dengue cases data. In other countries, they don't have it because they don't have this as a problem. And if so, how is the data? Sri Lanka has really good data. Also Taiwan. Indonesia, we have the data, but not good data. I will show it to you. I tried to get it also from our Minister of Health. They don't have a good data, especially in children. Yeah, I hope Minister of Health or representing also here, because divided by age, this is not what we want to actually from Indonesian Pediatric Society or also Indonesian Pediatric International Pediatric Association. How is the dengue prevention in your country? A lot of country, about 70%, they have campaign, bed net, immunization, and others. And some other start with the immunization is only in 2 countries. Is there dengue immunization in your country? Only 2 countries said yes, Thailand and Indonesia. I don't know, Philippines, they stopped probably because of the political situation. You can explain it later on here, but they don't respond for this survey. So in Indonesia, they start from 9 to 16 years old, and in Thailand also from 9 years old. So only 2 countries reported there is the immunization for dengue in the country. And that's the result from our survey. How about the climate change and dengue imminent threat? Even in our society, we have the environmental health, and also in APPA, and also in IPA. So we believe that climate change and dengue, this is the imminent threats. So if you are talking just about the viral, about the vaccine, you never think about the climate change. I don't think we can overcome this dengue. Yeah, we have some data of this: daily mean temperature, extreme precipitation, and climate change. This is related especially to the country like Indonesia. The projected geographic expansion of dengue distribution in 2050, you can see this is going to be the whole world if we are not doing anything. So all the experts here, I think, after this meeting, you have to give a lot of conclusion to all countries. You might send it to IPA. Yeah, you might send it to WHO, because I was in the WHA meeting. There is no single statement of dengue, if I can remember. So all the experts here, your voices have to be heard. Talk a lot. Give your expertise. The best thing you know about dengue, and then we can send it to WHO. So all the countries should aware that dengue should be a problem. So this is the Indonesia data, the total dengue cases. This is quite a higher number. But the thing is, they don't classify this as a children. You can see here below 1 year, 1 to 4 years old, 5 to 14, and after that, they consider it as an adult. Even though our country or Minister of Health already declared that children until 18 years old, but they keep giving this data. So you have to change. After this meeting, I think the Minister of Health related to dengue, you have to change this data until 18 years old. Otherwise, you know, we can see what's the problem. Because the children is until 18 years old. Come on, it's everywhere, in all over the world, including in Indonesia. How come your directorate or directorate general make this kind of data, even though you have it in your social media? So you have to change this. Please do. Yeah. So aspect to dengue control, you know about factor, human behavior, system, and private-public partnership. So these 4 factors, I think, related to dengue: host, agent, ecosystem, serotype, genotype, age, sex, clinical feature, primary infection, secondary infection, host response, and also related to seasonal distribution, climatic factor, environmental health. Again, environmental health, especially in rainy country like Indonesia, and economic environmental factor. So WHO Global Strategy for Dengue Prevention Control from 2012 to 2020. Technical element, there is diagnosis and case management, integrated surveillance of outbreak preparedness, sustainable factor, future vaccine, and basic operational. So it should be harmonized effort across national dengue surveillance system is needed. But even in Indonesia, they data not until 18 years old. How come we can do this? So we have to change in all countries. All experts should tell the Minister of Health, you have to change the data. Otherwise, we cannot analyze all of this data. Important factor for effective implementation and control strategy: advocacy, resource, partnership. This is what we are doing. Coordination, collaboration, communication to achieve behavior outcome, capacity building, monitoring, evaluation. So diagnosis and case management. Mortality from dengue can be reduced to almost zero by implementing timely, appropriate clinical management, which involve early clinical laboratory diagnosis, IV rehydration, staff training, and hospital reorganization. And also you have to have a good data in children until 18 years old, not only until 14 years old. Surveillance factor control, gather data on distribution of dengue cases. Surveillance focus on factor identification and eradication. Identify OV position size, mobilize the community. And dengue surveillance system should be part of the national information system. Tired data collection should include suspected, confirmed, and severe dengue cases. Surveillance, including also monitors impact of intervention. Biological cancer, use of bacteria such as Wolbachia to alter factor ability, releasing genetically modified Aedes aegypti, sterile insect technique, FIT. So I hope Professor Utarini also here, I quoted from your paper from New England, use Wolbachia as a method of dengue control. I think we have to support it in all countries. Recent study in Yogyakarta, infected Aedes aegypti mosquito with variety of defenses. A bacteria can cause resistance to infection by dengue virus and other arbovirus. And infectious mosquito, we can reduce 77% incidence among residents 3 to 45 years old. Protective against 4 dengue serotypes and 86 protection against hospitalization. So I like to close also this take-home message. We might just aware of dengue in previous time, but especially in this pandemic, we should be more aware, alerted, prepared for it. As today, dengue is already an endemic disease in more than 100 countries across WHO, region of Africa, America, Eastern Mediterranean, Southeast Asia, and Western Pacific. We must acknowledge that dengue is a collective problem. It affects society as a whole, and children in particular. Dengue is a global scale issue that needs a collective resolution as well. Therefore, as an active agent of global society, we should be eager to keep battling this disease. Every action, reaction, and consequence need to be considered carefully through collaboration. Again, collaboration all stakeholders. Moreover, study and research about dengue should be done, improved consistently. By doing this, a wise plot of action and acknowledgeable decision making, of course, can be made. Thank you. Congratulations again for this meeting, for dengue meeting, for World Dengue Day, and enjoy the meeting. Thank you again for everybody to giving Indonesian Pediatric Society to host this meeting. Thank you.